So here's the thing about COVID-19 that people are not understanding, especially when it comes to people having to go to work and making a basic living for themselves. Listen, I get everybody wants to know who's sick, who's infected, and who's not. But really think about it. If most people are living paycheck to paycheck, do you really think a lot of people are going to be out here self-reporting that they are not feeling well, especially if their job is not giving them stay-at-home pay? Okay, listen, I work in a home health agency, and if I don't work, I don't get paid. So if I'm generally feeling well, I'm not gonna report that, oh, I have a cough or I have a sneeze here and there, because the first thing they may say is, oh, well, you need to stay home. And I just can't afford to do that. Now, some people may look at it as, oh, well, you're risking your patients' lives or whatever, but really think about it. I mean, you go into that patient's home, their room, you're risking your life just by walking in, because you don't know who walked in before you or after you, or even while you're still in the same room. You're not the only person that's risking their life. There are so many factors and so many things that can enter into a home without it even being a person that can infect them. And it's not realistic for people to really say that, oh, you're just a terrible person because you're not going to self report that you're not feeling well. No. Am I a terrible person for wanting to supply myself with the basic essentials of living, especially when I don't have anyone else to take care of me? Am I a terrible person because I want to pay my bills? Am I a terrible person because my job won't supply me with stay-at-home benefits like your job is? Trust me, if it were you, I'm pretty sure you would be thinking the same thing. Most people are living paycheck to paycheck. Now, do I have an emergency saving? Yes. But do I want to deplete that saving because I'm waiting for test results, or I'm waiting for the job to reapprove me to work because they're needing X amount of doctor letters and notes or whatever to say it's okay for me to come back to work? Am I going to have to, and then on top of you getting approved to come back to work, now you have to explain to the family that you're okay. And now it's going to be a hassle to get you back into the working field, because people are still not going to want to be around you, especially if you've had it already. People are more cautious. People are more cautious of you admitting that you're not feeling well versus you just straight up not saying anything in the first place. I'm so tired of all of these little testing measures to see if you're feeling okay or not that don't even require you to be in person. I get a ton of apps from my job that is basically asking me questions like, do I feel okay? Like, of course I'm gonna say yes. Of course I'm not gonna bring attention to myself saying, no, I don't feel well, or no, I have a cough, because at the end of the day, I'm trying to support myself. I'm trying to continue to live while, most people are struggling to pay their bills. If I am generally feeling good, I'm not going to sit up here and report that I have a cough or that I have a headache that came from somewhere. I don't know where that came from. I'm not going to jump to conclusions and say that, oh, it's definitely COVID-19 related. Because think about it. We have tests kits that are coming into this country that are being tested for COVID-19 and that are being marked positive of having COVID-19. So you're sitting up here telling me that I need to go and get tested when the tests themselves are being tested positive for COVID-19. How am I supposed to trust that? How am I supposed to trust that? I've done a study recently polling healthcare workers, including nurses and doctors, to see who would take the COVID-19 vaccine if it were to come out. 98% of the healthcare workers said that they will not take it. 98%. 98%. And I asked them, I said, if the job requires you to take this vaccine before you can start working, would you take it? 98% of them said no, and that they would go and find work elsewhere. So you tell me. You tell me. I even did a poll asking them, if people are living paycheck to paycheck, do you really think people are out here self-reporting? Most of those people said no. Those people that said no came to that conclusion because their job does not offer any benefits if you are not working. If you call in and say that you are feeling ill, their job doesn't offer any benefits. Their job doesn't offer you any pay. Their job doesn't have any sick leave pay. They don't have that. So if they don't go to work, they don't get paid. There's no PTO to use, you know. And the ones that said, yes, they are self-reporting are the ones whose job gives them money if they stay at home from work. So you tell me, not everyone's job has that luxury. I know mine's doesn't for sure. That's why I'm, hey, if I'm not feeling 100%, I'm not going to go and tell nobody that I got a cough here, that I got a sneeze here. I'm not telling nobody because ain't nobody paying my bills. Ain't nobody paying my mortgage. Ain't nobody paying my car note. Listen, I got stuff to do. I got to maintain myself. And if, like I said, if I ain't walking around with symptoms, I'm good. I'm going to work. Listen, how many of y'all go to work when you sick? I get it. Nowadays are different, but listen, at the end of the day, what you choosing? What you choosing? Really let that sink in, because everybody will push on you that, oh, you're a terrible person because you're gonna risk somebody else's life. No, I'm not risking their life. If they really so concerned, they wouldn't have nobody in their house. They wouldn't have nobody in their agency. They wouldn't have nobody here. So don't sit up here and tell me that I'm risking somebody's life. Listen, I'm not. At the end of the day, everybody got a choice of what they want to do. Everybody got a choice. Okay, everybody got a choice. We take risks every day. I'm taking a risk every day just by walking outside my house. You know what I'm saying? Like, so I don't get it. I don't get it. But that's just me. That's just me. I'm sure everybody out there are not terrible people like me. Because apparently I'm terrible because I want to pay my bills and because I don't get offered any benefits if I stay at home from work. I want to survive. Apparently that makes me a terrible person. But, you be the judge, to each his own, right?